طيب، بسم الله الرحمن الرحيم. الليلة يعني عندنا محاضرة قيمة جدا جدا مع ضيف غالي جدا جدا. We have Dr. Yasein Elgadal. He is a consultant psychiatrist currently in the UK. He was previously the head of Khartoum Psychiatric Special Center in Khartoum Teaching Hospital for Sudan. And he was also the chief of psychiatric services for Saudi Arabia for Aramco Medical Organization. He's also a postgraduate clinical tutor at the current University of Liverpool. He's well known يعني بمشاركاته يعني العلمية والثقافية. والليلة محاضرة قيمة جدا جدا مكونة من جزئين. It's about neurodevelopmental disorders. عندنا فيهم كمية من الضيوف. فشرفنا دكتور ياسين، تفضل الميكروفون معك.
Uh, Thank you, Dr. Yasir. First, I would like to thank Dr. Abdel Ghani and the Medical Specialization Board for organizing this very important training program, training and education program, which proved to be very successful. And also main thanks to Dr. Yasir for overseeing this presentation and before, after, and during the presentation. شكرا لكم. Thank you for all those attending. My talk is about neurodevelopmental disorders. The objective in this presentation, there will be an introduction to the topic. I will also share with you a case presentation of one of my patients. And then we will talk about autism, diagnosis and management in adult. As you know, I'm an adult psychiatrist. I'm not a child or adolescent psychiatrist. I will also mention our local mental health and autism service. And we have the pleasure of guests attending today who will share with us their experience about autism. And then I will leave you with resources and references at the end. As Yasir mentioned, I would like this presentation to be interactive. So to start with, I would like all the attendees, especially the trainees, to mention one condition which come under this title when we say neurodevelopmental disorders, or the other name neurodivergent disorders. So you can shout or you can write it in the chat, and Dr. Yasir will join this.
ADHD.
ADHD, yes.
Autistic spectrum.
Autism spectrum disorder, yes. ASD, yes.
Intellectual
Anything
disability.
else? Sorry?
Intellectual disability.
Intellectual disability, yes.
Childhood disintegrated disorder.
Childhood disintegrated disorder, yes. Is this one person or several people?
Communication disorder.
Communication disorders, yes, yes.
Cerebral palsy.
Sorry?
Cerebral palsy.
Cerebral palsy, yes. Yalla. Any more? Floor is open for everybody, so other people can join in.
من الشات في isolated speech disorder وفي dyslexia.
Excellent, excellent. Anything else?
Learning difficulties, maybe specific dyslexia and mathematics difficulties.
Yeah, good. Even though the sound is crackling, but yes.
Motor disorders.
Sorry?
Motor disorders.
Motor disorders, yes.
Related to communication disorders, maybe speech, sound disorders, or
speech sound disorders, yes. This is good. عند أسامي. هتشوفها بعد شوية.
Turner syndrome.
Dysphonia, yes, excellent.
Conduct disorder.
Conduct disorder, did you say?
Yes.
Yeah, okay. Anything else?
Tourette syndrome.
Tourette syndrome, yes. Yes.
Tics disorder.
Tics disorder, yes.
attention deficit ذكرت attention deficit hyperactivity disorder.
Yeah, ADHD is mentioned.
Okay.
Rett syndrome.
Rett syndrome, yes. Sorry?
Obsessional defense disorder.
Obsession. Yeah, good, yeah. Did you get all this?
Dyscalculia.
Dyscalculia, yes. Did you get all this, Yasir?
كلهم. Yep.
Okay. Can you just read them back, please?
أول واحدة ADHD, ASD, intellectual disability, childhood disintegrating disorder, communication disorder, cerebral palsy, isolated speech disorder, dyslexia, global developmental disorder, dysphonia, motor syndromes, Tourette syndrome, tics, Rett syndrome, and OCD.
Excellent. As you can see, I think you did very well. This is a very interactive group. As you can see, from this diagram is neurodivergent or neurodevelopmental is like an umbrella, which have under it all these disorders which you have mentioned, ADHD, ASPD, DID, OSDD, BPD, NPD, dyslexia, complex PTSD, dyspraxia, sensory processing, dyscalculia, dysgraphia, PTSD, bipolar, autism, epilepsy, OCD, acquired brain injury, tics disorder, schizophrenia, was not mentioned, misophonia, HPD, sensory Down syndrome, and synesthesia. So all these disorders come under the neurodivergent disorders. If you look at this diagram on the right side of the screen, you can see neurodivergent people, how they stick out from general population. And if you have a group of neurodivergent people with neurodivergent disorders, you can look on the left side. You can see that this is they all different. They are not the same. They are not the same. So just this picture to put it in your mind that people with neurodiversity are very diverse themselves. There is an issue of language we use to describe people with autism or these neurodivergent disorders. As you can see, these are the things we mentioned. We say people have ASD or ACS or Asperger's. We say people with autism and neurodivergence. Sometimes when we see them in the clinic, we say they are not engaging or are selectively mute, or they're completely normal, or they have pathological demand avoidance, or they are self-diagnosed. And sometimes we describe them as high or low functioning autism. This is, as you can see, the sign here is like negative. Here, the positive side here. The autistic people like to be called autistic. Yeah, they don't mind to call them autistic or neurodivergent. This from research by these people. When we say they are not engaging, we say not being made accessible for. They are not accessible for this because we did not understand the way they get engaged. When we say they are selectively mute, they like to be described as situational non-speaking. They don't speak in certain situations, maybe they speak in others. Sometimes say normal, they like to be called neurotypical or holistic. And when we say pathological demand avoidance, the term they prefer is pervasive drive for autonomy. And self-diagnose is that they are self-discovered. They discover that they have autism. So the language was used, they found there is kind of stigma used to deal with people with autism. So now I'm going to flip to the all right, we carry on now. The main, after presenting the case, this presentation is courtesy of Dr. Quentin Deely. He is from National Autism Unit, an expert senior lecturer in social behavior, neurodevelopmental service, forensic, and Institute of Psychiatry, Psychology, and Neuroscience. So I acknowledge and thank him for letting me share this with you. If you just go take a historical look at autism, Kanner described in 1943 autistic disturbance of affective contact, talked about shortly after birth, there will be profound lack of social engagement, echolalia, literalness, pronominal reversal, unusual responses to inanimate environment, and difficulty of change. In 1944 in Vienna, Asperger's, famous Asperger, talked about autistic psychopathy. He thought that it is only occur in males. There is a strong language and cognitive skills, and it runs in families, and they have interest in acquiring unusual knowledge. Then later came in 1981, 1984, more description by Wing, where they mention the communication, socialization, and imagination. ICD-10 described childhood autism as qualitative impairment, reciprocal social interaction, qualitative impairments in communication, and restricted stereotype patterns of behavior, interest, and activities. In the DSM-5, characterized by 2 domains instead of 3 domains in ICD-10. Here, the main domains are persistent deficits in the ability to initiate and to sustain reciprocal social interaction and social communication. Restricted, repetitive, and inflexible pattern of behavior, interest or activities, including differences in sensory sensitivities and interest. The DSM-5. الكرايتيريا موجودة هنا طبعا A و B و C و D. في ال A بيقول لك persistent deficit in social communication and social interaction across context, not accounted for by general development delays, and manifest by all 3 of the following. There should be deficit in social emotional reciprocity, deficit in non-verbal communication behavior used for social interaction, and deficit in developing, maintaining relationship. The basic the main diagnosis. In B, there is restricted repetitive pattern of behavior, interest, or activities as manifested by at least 2 of the following. Either stereotype repetitive speech, motor movement, or use of objects, or excessive adherence to routine, ritualized pattern of verbal and non-verbal behavior, or excessive resistance to change. The third one, highly restrictive, fixated interest that are abnormal in intensity or focus. Hypo or hyperactivity, reactivity to sensory input, or unusual interest in sensory aspect of the environment. C, symptoms must be present in early childhood, but may not become fully manifested until social demands exceed limited capabilities. Symptoms together limit and impair everyday functioning. DSM criteria, diagnostic criteria. Now as we seen in that umbrella, autism is associated with other neurodevelopmental disorder. People mention specific learning disabilities in language, dyslexia or dyscalculia, attention deficit, ADHD, developmental coordination disorder, DCD. In children, ADHD is 30% of autistic children have ADHD as compared to 4 in the general population. المعلومات دي تنفع MCQ عبد الله في الامتحانات. Tics في children 10%, in the general population is 6. DCD 70% versus 5% in the general population, and epilepsy 5% versus 1% in general population. For adults, most neurodevelopmental disorder improve with age. ADHD is present in 30 to 45%, as mentioned in Polderman in 2014, and epilepsy is 5% of those. Autistic adults who do not have an intellectual disability as per these two researchers. If we try to think about autism spectrum, we can think about it as a disorder, as I've been saying through or we can think about autism as a disability, a condition that requires specialist remedial education and environmental adaptation to help the individual to enjoy as independent a life as possible. Or talk about autism as a neurodiversity, as a condition, not a disorder or disability, rather than disorder. So it depends. All this definition has implication to management, to finance, to funding, to all this aspect of care. Diagnosis. In diagnosis, we use autism diagnostic interview. This is a clinician administered, involving parents, carers, covering social interaction, communication, restricted behavior in the first year of life. So this is for children, and it is less reliable in adults. The other one, which can be used both for adult and children, is the ADOS, Autism Diagnostic Observation Schedule. This is a clinician interview and observation of the patient. طبعا الآن في screening في الإنترنت، في patient can screen themselves for autism in the internet. يعني بيجيك هو ذاته self diagnosed or self discovered, as I mentioned earlier. طيب, the prevalence childhood autism, once considered to be rare, used to be thought to be 4 in every 10,000, but the recent estimated it at 20 to 40 per 10,000. Broad autism spectrum disorder is almost 1%. It's like schizophrenia. It's 100 per 10,000 in a South London study. ASD and IQ. 50% of individuals with ASD have an IQ below 70, i.e. that they have learning disability. They are in the learning disability range. This proportion revised downwards from 75%. كان بيفتكروا أنه 75% of autistic children have IQ below 70, but now this has gone down to 50 because of the increasing recognition of ASD in children with normal IQ. يعني في children عندهم normal IQ لكن عندهم autism. Gender, طبعا used to be thought is only in males, but males have a higher rate, 4 times higher than females. Excess in males increases with IQ. Asperger syndrome, 10 males and 1 female. The ratio is 10 to 1. Note that the sex ratio slightly lower in studies using active population-based case finding than passive case finding studies that use administrative data. يعني population based better than the case report from hospital case record. Let us not forget to mention the positive attribute of autism. Autistic people have strong persistent interest in certain things like music, art, math, whatever. They have attention to details. They have unusual memory. They have fascination with systems and patterns, and ability to concentrate for long periods that may be conducive to creativity and originality. They have heightened skills in superior visual functioning and musical processing. The question is that can biomarkers help protect the positive and help the negative features? Yani, can we enhance these negative attributes and down the negative aspect by finding biomarkers in these people? The definition of autism has changed through the time. Between 1940 and 1990s, it was thought to be the narrow definition, and that is rare, affecting mainly children. Discrete and distinct, that is very specific disorder, is a single condition, a focus of pure autism, a developmental disorder. Since the 90s, the thinking is that this is a wide spectrum, autism spectrum disorder or autism spectrum condition, that it is relatively common, as we have mentioned in the prevalence, though probably unrecognized in women. Lifelong conditions, it is a lifelong condition. It is dimensional, it is not a single condition. The autism and fractionable. Fractionable means that the different types of the areas of the brain work differently. There is a complexity and comorbidity, as we will see in a minute, and that this is the neurodiversity and participatory research have helped. Participatory research means that people with autism, their families, they are now taking part in research in advancing the knowledge about autism. Genes and the environment and neurodevelopmental. I'm not going to go into details about this, but I will share this with you, this PDF. I will send it to Yasir. He can share it with you as a PDF. So I'm not going to go into details, just to mention that heritability is 40 to 90% in twin and family studies. There are more than 100 genes and genomic regions associated with autism. Most genes increasing the risk for ASD are common alleles. 10 to 20% of people with autism have the de novo point mutation. That means they don't have family history. They have out of the blue kind of mutation. I'm going to skip these details. Just to mention the areas of the brain, ADSD are caused by abnormalities in multiple brain regions and networks, not single structure. This Nazovich in 2006 identified the amygdala, and that did not relate to verbal or repetitive behavior, predicted at most 53% of the variance in non-verbal social impairment. The implication is that attention ASD characterized by deficit in multiple function of large-scale neurocognitive network comprising the social brain. Here is a mapping of the areas that involve in the autism disorders and neurodevelopmental disorders. For example, mentalizing. You have these, I don't want to go through them because of the time, and emotional empathy and learning, again, in these regions, and mirroring and action observation and execution in these areas. I will leave this with you. You can look at it in details. Again, just mentioning a word about management before I share with you the what we do locally for the management of autistic or neurodivergent people. Now there is adult service. Used to be child and adolescent. Now there is well recognized adult service of neurodivergent or neurodevelopmental disorder services. Focus on mental health and independence. Focus on employment and social skills. There is limited evidence about any specific treatment, like people say herbal, all sorts of things you see in the internet that can treat autism. People use adapted CBT for anxiety, and also these people need support in relation to transport and job support. Very important to mention comorbidity and autism spectrum disorders. As you can see there, ADHD, as we mentioned earlier, is 30 to 45%. Intellectual disability is 30 to 80%. Depression is 4 to 38%. Anxiety disorder from 11 to 76%. Obviously, these different studies, but it's giving you the range. Obsessive compulsive disorders is 25 to 50%. Schizophrenia is 7 to 35%. Bipolar affective disorder, 3 to 9%. Catatonia, movement disorders, is 4.5 to 20%. I've just attended an intellectual disability conference on Friday, and they presented a case of catatonia in somebody with autism. It was very interesting and how they treated it. Specific reading and writing difficulties. Prevalence vary with population studied and method of assigning diagnosis. This is a timeline of developing autism, comparing autism and schizophrenia and autism with psychosis. Again, I'm not going to go into details. As you can see, psychotic disorder, autism, and in the middle, they share these characteristics together. They have similarities and differences in clinical features, autism and psychotic disorders. Features of ASD that predisposes towards a quasi-psychotic symptoms. For example, from research, they found problem with perspective taking. Perspective taking means empathy, that the patient with autism, they don't have empathy. They don't put themselves in the other person's shoes to understand what that person mean or feel or think. Intensity to social norms. Difficulties in monitoring responses to speech, content, or behavior. Pragmatic speech problem, for example, omission of logical connection between speech topics, particularly when stressed, when under stress. Also, one-sided communication dominated by salient preoccupation. يعني تلقى الautistic person concentrate on specific topic ما بزح منها يعني they don't move out of it. High social anxiety and default assumption that people are hostile because of years of bullying. As we were seeing from that case presentation, the mother said the relationship is good. The patient said the relationship is not good, describes the mother as abusive. So that could be true, could be related to his their autism. ASD and affective disorders, there is an increased risk, as we mentioned earlier. It is not always clear whether one is dealing with a trait or a state. Chronic dysphoria may emerge with major depressive episodes. This can present as anger, aggressiveness, all this. Anxiety may merge with phobic disorders, and over-arousal may merge with panic disorders. So there is a kind of overlap between these disorders and features of autism. Very important, ASD and OCD. There is increased prevalence of sexual thinking and ritualistic behavior. If this is not, in fact, OCD, then the rate is significantly raised. Alternatively, this may not be OCD. They could be no internal resistance and anxiety, يعني repetitive movement في autistic people ما مع anxiety. It doesn't have anxiety like OCD. The content of obsession and forms of compulsion differ from classical OCD. But this could still represent a pathoplastic effect of PDD and comorbid OCD, pervasive developmental disorder and comorbid OCD. Eating disorder, and this is, I've seen a few cases of ARFID, which is avoidance restrictive food intake disorder. This is common with people with ASD. They have sensory sensibilities, resistant to dietary change, intense interest in a specific diet. And in one patient I have, he will only eat egg and toast. He doesn't eat anything else. All day they just eat a piece of toast with an egg on it. As well as too literal response to dietary advice. That means very restricted, bizarre diet and pattern of eating, which is difficult to change and potentially dangerous, particularly when combined with preoccupation with fitness and exercise. Anorexia nervosa associated with autism, difficulty identifying autism in adult women in the presence of comorbid occurring psychiatric disorder. Being underweight may lead to pervasive autistic symptomatology or mask previously unrecognized autism. So there is always interaction between autism and eating disorders. Catatonia, I mentioned. In catatonia, you have a stereotype, complex mannerism, echolalia, difficulty initiating complex action, unusual slowness, mutism, passivity, and freezing. Autism, schizophrenia, OCD, and depression. So these all interact with, can happen, all these conditions can have catatonia features in them. Gender dysphoria, as you saw from my patient, or gender incongruence in ICD-11 now called, autistic traits appear to overrepresented in gender identity clinics. Like people non-binary, they have high representation in autistic people. It has been suggested that there may be an association. The assessment and management of gender dysphoria should be in line with existing guidance by the Royal College of Psychiatrists report in 2012. Neurodevelopmental state may be relevant, but should not hinder the access to a gender identity service. طبعا gender identity ديل مثلا they go to a clinic, if they moving from male to a female, they will be given hormone, masculinizing hormone. If they are moving from man to a woman, they will be given feminizing hormones, varies by the specialist center and then by the GP. The principle of management is mainly psychoeducation, as you can see from our local service. As I mentioned earlier, adapted CBT and other psychological interventions. Social intervention and social support is very important. Assess and treat coexistent conditions like anxiety, depression, bipolar, eating disorder, OCD, all this. Yeah. Medication, we use the same medication we use for mental ill people. So there is no specific medication for people with autism, but the advice is to start low and go slow. As you can see, I started my patient on duloxetine 30 milligram and to increase after 2 weeks to 60 milligram. Low dose antipsychotic for anxiety and irritability. People here use quetiapine 25 milligram or 50 milligram. We recommend people to follow the Mosley prescribing guidelines. Now I'll go back to my other presentation. I hope the technology work again. Let me go back to share and try to find.
ظاهرة.
Okay. So I finished with autism diagnosis and management. Just before we talk about our local service, I would like to invite our guest, Mr. Nazar Al-Madani, to tell us about his experience with autism. Nazar, are you there?
Assalamu alaikum.
Thank you for sharing this experience.
Yeah.
I know it's not easy, but thank you for, if you could just, I know you have a 16-year-old son with autism. Can you tell us can you tell us when did you and your wife notice signs of, before knowing that your son has suffered from autism, what age?
Yeah. First of all, thank you for having me, Doctor, really, for this chance. You guys all with the medical background. I will start from the beginning. I was working in Dubai, the fraud investigator, which is totally different than medical. When after moved to UK, continue working as an investigator. But it was the child, he was my first boy, and he born in 2007. My story maybe is normal to you guys. Maybe you heard it before. But I told the doctor, and we was talking about it, because in 2007, when he born, he been diagnosed with autistic 2011. We are talking about 5 years. And it was a long journey until we found that is the boy, he has autistic. Even that time, I think 2011, few people knows what is autistic exactly. The signs, we realized the signs of autistic with our child since 3 years old. So he started flapping, not responding to his name, and not engaged with the children while in nursery. Even
but before the age of 3, you thought he was. Yeah.
We understand there is something wrong. Even my wife, she said there is something wrong with our son, but we couldn't know what exactly. He was normal. He started saying normal words, Baba, Mama, and normal development for the child. But it was not normal, because it is just few words. Suppose 3 years has to talk normally. So we start our journey with the hospitals. We were just thinking about something else, not autistic. 2011, finally in Dubai Health Care City, There is a doctor, he said this is the sign of autistic. And unfortunately, there is no proper or a specialist school in there, only about 2 schools or 1 school in Dubai. So we know now what is the reason. It is autistic, and we start the journey. It was very long journey, but really what I'm trying to say here, you are guys are doctors, you have to understand, I'm just giving you some advices from my experience, because after that, I just spent a lot of years to study about the autistic. I have tried to having 2 careers, working in a financial sector, and at the same time working with the children. Even when I moved to Dubai here, I work volunteer with the nursery just to understand what I have to do for my child. The involvement of the parent, active involvement, it is the key. It is a key word for this development journey. This journey could be short or could be long. It is a kind of cooperation between the doctor, between the schools, between the teacher, any carer, anybody involved on this child's life. You have to, as a doctor, you have to involve the parent deeply. We start with having what we call it here is SINCO, which is special education needs coordinator, which is a plan but for 12 years, for 12 months, early plan. This plan legally binding here in UK, binding for the school, whatever school or college, or for the parent and for the doctors, any medical GB or specialist involved on this one. This is the plan. After 12 years, after 12 months, it is subject to review to see did we achieve this plan or not. As a doctor or medical, you will never achieve the full plan unless you get the parent involved actively with this. The parent will tell you many details. They are the main resource of the information. Yes, I can hear, see the diagnosis, the medical stuff, which is valuable. Really, I enjoy this presentation with you, doctor. But how to apply this in the reality? Your resources, information resources, is the parent, the father and the mom. They will tell you the behavior. They will tell you the daily what he's done, what he's. From these resources, you will understand what is the best language to communicate with the child. For my case, my child was best. Let him to understand anything with the screen, TV, anything with the screen. This is the best channel to pass the information to his brain, and we use it positively. So we started with the medical to communicate through the images to let him understand the alphabetic one by one. We are talking, we are repeating it, but he will not give you attention like many autistic child. But he will listen to the picture, he will listen to the images, and will understand. So we started one by one, all the alphabetic. Then after that, we started how to put it in sentences, simple sentence. All this kind of just to develop his language communication. So in general, I don't want to take more time, but really it is now he's 17 years old. Now he's in college. He's very smart. He's a math champion. He's intelligent because his brain is capacity is unlimited. Unlimited capacity of his brain. He will remember everything. He will, if he saw anything, he can draw it typically. So it is a triangle between the parent, the school or college, and the doctors. It is a development plan. Yeah, that is in general. I'll give you. I'm not going to go in details, but really, I'm advising or just to remind you involving the parent on this. bring them their concern, whatever they want to tell you, let them know their rights, and they will follow with the educational plan for each child, because each autistic child has different than others. My boy was very severe autistic, very challenging case. He was harming himself physically. You can't predict him what he's going to do. When I am now remember those days and see him right now, it's totally different. It's totally different. We have achieved really, and we have, because we are just involved with this. My involvement, me and mom, with the school, with the council, with the GBs now, directed me from fraud investigator in financial to I study the autistic, right? And the doctor knows now.
Yeah.
I'm
Thank
taking
you.
further.
Thank you,
Yeah.
Nazar, for sharing this very important experience. I know that your son is 17, he's the eldest one, and after that you went on to have 3 more children, 2 boys and 1 girl, and they're all normal. Yeah, as we mean about normal. No, they don't have any issues. Yeah.
They don't have any issue because we have done any genetic. We don't have any or anything. There is no reason for this autistic. There is, yeah, you can think about something. We discussed this before, doctor. What is the reason behind the autistic? And
thank you very much. So if you could stay with us, maybe some of the attendees would like to ask you a question later. If you can stay with us for the rest of the presentation.
Yeah, no worries. I'm happy.
Okay. All right, thank you.
Thanks.
So I go back to before I go back, anybody want to have just one question to Mr. Nazar? Anyone have like a burning question they want to ask now and wait later?
أنا عندي سؤال والله يعني سؤالي هو هل الكيس بتاعته اعتبرت يعني أسبيرجر سندروم؟ لأن كان عرفت إن الأسبيرجر بتكون عندهم intellectual capability أعلى من الباقيين من الأطفال الأوتستيك العاديين. فهل هو diagnosed أسبيرجر ولا حاجة ثانية؟
Is he diagnosed as Asperger's or just autism? The question is.
No, it's just autism. He's autistic, and there is only the brain issue. Even if you see him, he's just normal boy, peaceful boy. You will not realize that he got autistic unless talk to you, or just for the behavior only. We have the challenge.
Okay, thank you, and thank you the person who asked the question. Just question about our local service here in Brighton. As you can see, working through mainly psychoeducation and neuroaffirmative. Neuroaffirmative means bringing the correct language, the correct behavior, the correct service in these domains mentioned there: cognitive, social, the nervous system, the psychological aspect, and the self-acceptance. This base activity is if you Google it, is neuroaffirmative, is like a specific service in addition to all the other one. I will leave this with the presentation. Other types, our neurodivergent practitioner offer a one-off consultation to assist with care planning. Signposting means referring to and providing appropriate reasonable adjustment, understanding presentation. طبعا هنا in England there is a separate neurodevelopmental service. All people with neurodiversity or neurodevelopmental condition are referred to this service. They need to have a diagnosis from that service, and then they come to us already diagnosed. But here, sometimes we see people who, because the waiting time for this service is almost like 4 years, and now people start to going private. There are two companies who does private diagnosis, one called Psychiatry UK and another one called Clinical Partners. But even Psychiatry UK, the waiting time for them is more than 1 year, and the Clinical Partners, the waiting time is about 2 to 3 months. So people sometimes go private, they get diagnosed, they come back to us for medication or follow-up. They offer one-off piece of advocacy and support with PIP, which is individual benefit. This is like social benefit. Referral to social specialist services, like other services, like in my patient, rheumatology, speech and language service, short-term psychoeducation with family, carers and supporters, as Mr. Al-Madani has mentioned, request to join the initial assessment, and also rejoin the cluster or seminar meeting. And sometimes we invite the patient and their family to join our assessment meeting. Local support for neurodivergent patient, as I mentioned, those without the diagnosis and those with the diagnosis. Those without the diagnosis, we have several services. This is called neurodivergent mental health practitioner. Basically, they are nurses or occupational therapists who specialize in neurodivergent condition, and they are doing a great job. There is a place called the Recovery College where the people can go and drop in and have a chat and have a coffee. There is a ADHD aware group, support group, Brighton Neurodivergent Community, Brighton Autistic Movement, Ad Hoc Autistic, Amaze Sussex, all for One for All Forest School. For those who have a diagnosis, they go to this specific neurodiversity or neurodevelopmental service. And there is one service called TCAT, which is Transforming Care of Autism Team. They offer intensive intervention for people in inpatient care or imminent risk of admission. There is also supported employment service from Brighton and Hove Council. So these are the local services. All can be accessed online. And then in our team, we have two mental health neurodivergent therapists. One of them is male and who work as a nurse, and another one is a female whose background is an occupational therapist. A lot of resources in the social media. These here, I'm not going to go through them, but you can go through them later at your leisure time. All these are in the social media. There are important websites which you can access. For example, Ambitious About Autism, Neuroclastic, Emergent Divergence, The Girl with the Curly Hair, Ehlers-Danlos Syndrome, Support UK. There is research resources you can, if you are interested in doing research. These people very, very useful to get in touch with. There are tools which is found in the National Autistic Society. They have guide on adapting talking therapies for autistic people, neurodivergent insight, Venn diagrams, autistic burnout symptoms checklist, burnout assessment management tools, embrace autism quizzes, BASE I mentioned earlier, exercise, neurodivergent staff material group, space and sensory.
السلايد واقفة ما تحط.
Sorry? ما واضحة؟
السلايد ما
ما
متحركة، انت
تحرك.
بتتكلم وما الخلفية قاعدة في اللوكال سبورت for neurodivergent disorder patient
كده ما اتحركت؟
ما تحركت.
في أي سلايدز؟
لوكال سبورت الأولى.
في دي؟
أيوة اللوكال سبورت فور نيورو دايفرجنت.
أوكي. طيب الآن اتحركت؟
ما تحركت.
لا ما
ممكن
تحرك.
تعمل ممكن تعمل تزيح الشير وتاني ترجعه.
أوكي. شير. أوكي كده متحركة؟
Yes.
ده
Okay.
متحركة.
So these are the slides I mentioned, which you didn't see. I mentioned those with local support of neurodivergent patient, those with diagnosis, I mentioned the types, and those with the diagnosis, without the diagnosis. I mentioned in our team, we have a nurse who is called neurodivergent therapist, and another occupational therapist also as a neurodivergent therapist. Are very good. We refer patient to them, and they're very good in dealing with them. Sometimes they come and sit with us in the interview because it is difficult to interview to do a normal psychiatric evaluation with the patient with autism. They might not sit in the same chair. They might want the curtains closed. They might react to my voice. There is different thing which the neurodivergent can pick and advise us how to deal with the person with autism. I mentioned the social media. All these many resources in the social media. You can go through them at your leisure time. Practical advice for autistic people struggling with mental health, neurodiversion in the workplace, and reasonable adjustment. Then there are website I mentioned, I read them earlier. These are the website here. You can go through them. If you want to do research, these are the people to get in touch with. There are tools which very, very useful from this organization, like National Autistic Society, Neurodivergent Insight, Autistic Burnout Symptom Checklist, Burnout Assessment and Management, and Embrace Autism, Base Exercise I mentioned, Space Framework, and Sensory Work by Blair Foundation. There are also podcasts you can listen to. Autistic at 40, Divergent Conversation, Neurodivergent Woman, Square Hole, Meet My Autistic Brain, Square Peg podcast. Oh, that's just my autism. And there are TV shows which you can access through Netflix or YouTube. Inside Our Autistic Minds, Chris McGuinness, Unmasking My Autism, and other TVs like shows Love on the Spectrum, Extraordinary Attorney, Big Bang Theory, House MD, The Good Doctor, Private ADHD Clinic Exposed. There are also books you can get hold of. These mentioned here: Unmasking Autism, Gail Unmasked, Self-Care with for Autistic People, Unmasked by Ellie Middleton, How Not to Fit In, An Apologetic Guide to Navigating Autism and ADHD, the Neurodivergent Friendly Workshop, We Are Not Broken, Changing the Autism Conversation, Empire of Normality, Neurodiversity, and Capitalism. All these are very interesting and useful books. Now I come to the end of my presentation, and we'll open the floor for questions, comments, and discussion.
شكرا جزيلا دكتور ياسين. لغايه نفتح الباب للاسئله. دكتور عبد الغني تفضل اول حاجه.
شكرا دكتور ياسين، وشكرا للأستاذ نزار
I just suggest إنه لو في أي أسئلة للأستاذ نزار الناس تبتدي بها عشان يمشي، ما في داعي يعني يمسكوها
Okay. Yeah, good.
ولو سمح لي الأستاذ نزار، يعني أنا حقيقة يعني أشيد بمجهودك وبوالدته. في النهاية الحمد لله long journey came to be fruitful. عندي برضو سؤال أو سؤالين. هل في الجيرني بتاعتكم دي any medications were involved في المانجمنت بلان، أدوية؟ وهل he went to the special schools up to what age ولا normal stream schools؟ وأشكرك تاني حقيقة، وربنا يحفظه ويحفظ أولادك يا أخي. عبد الغني الشيخ.
عبد الغني ده رئيس المجلس بتاعنا يا نزار.
ما شاء الله ما شاء الله. قال لك ترى حسارد على كيف رئيس المجلس ده. المهم والله جدا يعني انا مش شاكركم كلكم انكم يعني to have me on this meeting. I enjoy it, really I enjoy it. بالنسبه لسؤالك الميديكيشن يا دكتور, we don't have any medication. We avoid to use any kind of medication. We just rely on the normal behavior development plan. We just work closely with the school. When we were in Dubai, I remember in Winchester School, they kick him out simply after many times of attempting to apply a shadow teacher. But finally we just found ourselves we have to leave the country and come to UK. In UK, they register enroll him in a specialist school. So he started with the specialist school here for the children with autistic. They're not calling autistic difficult learning child. Any children with difficult learning here in UK, they just put him in the school. You can find some school they are registering difficult cases. Some of school they are depend on your case. This is what it is not usual rules, but this is what we understand when we come to choose the school, special school for him. So answer to your question, no any kind of medication. We avoid any kind of medication. Even we avoid many type of food. I'm just, because this one question I asked the doctor about it, what is the relation between the autistic child and the digestive system? Because his digestive system is not working normally, abnormally like anyone. So no medication, special food, organic food, and we continue the journey with the specialist school. Yeah.
شكرا جزيلا. And this just support to the point which Dr. Yasein mentioned إنه للtrainees أنا بتكلم there are no specific medications for the autistic spectrum disorders يعني. والحمد لله يعني you did a very good job with the behavioral aspect, with the cognitive aspects without medications. لأنه sometimes medications are needed in very few cases, لكن sometimes medications complicate the problem because of the side effects of the medications. شكرا جزيلا لك يا أستاذ المدني. شكرا.
Okay, any further question to Mr. المدني?
السلام عليكم.
وعليكم السلام.
ايوه شكرا جزيلا استاذ نزار على حضورك معنا ومشاركتك وكلمتنا عن الابن بتاعك وربنا يشفيك ده. طيب يمكن انا عندي سؤال. كثير او بعض الاطفال اللي عندهم اوتستيك ديسوردر.
ممكن تعرف نفسك؟
دكتور حمد ابراهيم كونسلتنت سايكاتريست.
سلام شيخ حمد.
الله يبارك فيك. سؤالي لاستاذ نزار، بعض الاوتستيك تشيلدرن رغم انه بيكون عندهم لو اي كيو بيكون سوبر انتليجنت في ارياز معينه. ويمكن لاحظنا في الميديا كان واحد من الاوتستيك جابوه في التلفزيون كان بيعمل عمليات حسابيه معقده جدا جدا، وبعضهم بيكون حافظ المصحف حتى الصفحه والايه بصوره كده يعني ذكاء خارق يعني. فهو قبل ذكر انه ولد الذكاء بتاعه كويس، فعايز اعرف هل الذكاء كويس طبيعي زي الاطفال التانيين، ولا في حاجه خارقه سوبر؟ هل عنده حاجه زي كده ولا لا؟ وشكرا لك مره اخرى.
شكرا يا دكتور على السؤال صراحه. يعني I'm happy to answer it. نحن في حاجه كان لفتت نظري اول ما كنا في رحله العلاج في دبي، وكنا بنتنقل من مستشفى لمستشفى، فعملت له MRI، فكان نتيجه الMRI انه في، بمعنى انه في كهرباء كثيره في الراس. ف قمت ربطت لاحقا just later on I'm just link all this with his behavior and what is he's doing right now. He's more intelligent in saving the memory rather comparing with any other child. They just got kind of unlimited capacity inside. They can save a memory. I'm not talking about normal memory. It's small details. They got a high intention to small details. We left Dubai in 2011, and until now he's 17 years old. He can draw where we live, not only where we live, the details of the house. If I give you example, if there is in 2000, we left 2011, if there is a small picture in the wall, he will draw it. He will draw what is the picture. It's not for some person, no, normal picture, he will draw it. This kind of memory he got. And he remember everything. He have an intelligent on construction and building sites. And normally I'm give him time. Just every day I'm buying A4, A4 paper, back of A4 paper. If he have a time, he would finish it. He would just drawing anything inside his brain. And I use this way to understand, because I need to put him in the right track. I need to use these skills in the right track. So, and this is the way of pass this information. I have evidence. This is what he's drawing. And he remember everything. He remember the geographic, he remember the cities, he remember entire the world, and all this information. He need to pass it. He need just to upload this information to the paper. And that's the way the parent is using this paper and give it to the teacher. So I know he's very smart. He's very smart. Now he's in the way of studying the designation for designing and
Thank you.
civil work.
Does that answer your question, Ahmed?
Yeah.
Yes, media, it is well known as islands of precocity. Islands of precocity بتكون عند الأوتيستيك children.
Yes, yes.
طبعا مصطلحاتكم دي لسه شوية بنتعلم فيها.
جزر من العبقرية.
يس حاجة زي كده.
هو صراحة أي طفل عنده توحد، لأنه أنا بمشي المدرسة وبحاول أقارن ولدي بالأولاد التانيين، ف it's just very different between case to case.
Yeah.
It is still, you can't understand what is why the autistic is not. You can't find another boy with the typical condition like a child.
طيب عندي سؤال أنا ممكن؟
تفضل.
طيب. شكرا لك جدا أستاذ نزار. سؤالي شوية يعني ديفيتد شوية، بعيد شوية من الجانب العلمي، لكن فزول تاني بيتكلم بيشوش علي. اوكي. سؤالي هو طبعا يعني انت كشخص يعني طوعت قبل كده في نيرسري وكده، انت كيف كان يعني كيف انت الابروتش بتاعك تهان، كيف كنت بتتعامل مع اولياء الامور التانيين اللي هم عندهم أولادهم عندهم كيس قريبة من حالة ابنك يعني. وفي نفس الوقت كيف أنت كنت يعني بتدعم زوجتك وزوجتك بتدعمك، لأنه الموضوع ده متعب جدا. أنتوا كيف قدرت تتحاول يعني تجربتك الشخصية في الحاجة دي؟
كويس. I'm happy to answer this question. I can't have a short answer to this, but I'm going to say something. It is a challenge, really. No one within your family will understand how the daily lives look like. And you have a child, unpredicted behavior. He can hurt himself anytime without any advance note. You have a child which he cannot integrate or interact with other children. And wherever you go for social life with the family, with the community around you, they will look to your child differently than others. And there is many questions on their face. They need to ask you, why your child is like that? The second challenge, where his sibling, I got four. I got another two boys and a girl. How they gonna accept the child? How they gonna accept their brother? Are they gonna be proud of him in front of their friends? This is also a big challenge. How to make different side. They are normal. Okay, why our brother is like that? They can deal with him inside the house normally, but in front of their friend in the school, sometimes they feel shame. So you have to deal with many situations. You have to accept. You have to acknowledge. I'm going to tell everyone here, I'm lucky to have this child. And any family with the autistic child, they are lucky. They are very lucky, because they're going to change the entire life of the family. As a parent, mom or dad, the key point, if they accept it, they should not deny it. If they accept it, they're going to do well, and they're going to help the child. And they must accept this. There should not be any kind of denial. Why you have this child? What, he's not going to be well. This is this condition for entire our life. Me and my wife, we were very, very positive, because my wife, she's from medical background. She's a pharmacist, clinical pharmacist. She were working in Canadian hospital in Dubai. Both of us, we complete each other for the benefit of this child. So we just deal normally with them. We explain to them. We explain to anybody he have a difficult learning issue, and we are working on it. We encourage any other to talk to him. We treat them normally. This is the same thing for your question. When I was working with the nursery, I work with the nursery as a volunteer, just to understand how to deal with my child. It is from personal view. I'm going to do this for my child. I'm not going to do it, okay, if it is shame, not shame, or if it is not like your job, what you're doing right now. But I will do everything for my child. So I have to go further and beyond for this. How to deal with the parent with the same situation, that is a good thing, because you need to be friendly with them. You need to not be friendly only, be close with them. You're going to help them, and they're going to help you. It is a kind of transfer of information. I understand many cases here. Every child with the autistic, I know their parents. I try to make a program for them. It's just for my child and for collecting some information, how they are dealing, how they found his diagnosis of autistic. I need to find something in common. And I'm working as an investigator, a fraud investigator, entire my life.
Yeah, that's very good. This
comes in benefit how to collect information. Sorry, doctor, I talked too much for this one. Sorry,
no, that's
the
good.
question
That's very
itself.
good, very useful. Thank you for that. I did mention the participatory research, which is mainly the information you just mentioned to the healthcare providers, that how they divide the service from mainly the work of parents and carers, not from lab research. Thank you for that. Any question?
عندي question هنا جاي من بروف زين رسلوا لي، فأقرأ لكم الرسالة. التحية والتقدير للحضور الكريم والشكر للدكتور القدال، وبارك الله فيك وزادك علما ونفعا بما علمتنا. السؤال: In your opinion, what are the factors that have contributed to increase of incidence and prevalence of ASD since the time of Kenner in 1943 and as of today?
That's a, that's a very big question. I will answer part of it, and other people can also jump in to add. I think, as I mentioned from the historical, that there is now more recognition that the disorder is not just in males or females, that it is not one disorder as shown in this picture. Now I'm showing in this slide that it is a dimensional disorder, and it has a lot of comorbidities. So sometimes the recognition, for example, I saw several patients, and when I talk to them, I ask them, they come for depression, they come with anxieties, they come with aggressive or drug abuse, or and I ask them, have you been assessed for autism or ADHD? And they always say, yeah, somebody said I must get assessed for autism. And in fact, when you assess them, they do meet the criteria for ASD and ADHD. So I think the main recognition among the healthcare professional, and now ASD and neurodivergent disorders, both in adult psychiatry and in child and adolescent psychiatry. Not in the past, it used to be only for children, but now we have a lot. In fact, my colleague Patrick is a consultant psychiatrist with us. He asked me, why don't we have a neurodiversity clinic in our clinic instead of see these people waiting for years and years to be assessed? I think that is there is research about finding biomarkers, about enhancing the neuroaffirmative features of autism, and dealing with the challenges exhibited by the negative aspect of autism. I don't know if that answers the prof. Anybody want to add to that? Please.
شكرا ياسين. Thank you very much Yasein for the answer. والتحية لأستاذنا دكتور زين. I agree with Dr. Yasein. I don't think that the incidence or the prevalence has increased. It was just a matter of underdiagnosis or misdiagnosis in the past. People, whether mental health professionals or even parents of kids, at that time they were not aware of this disorder. Sometimes they just call it is learning disability, mental retardation, all these old terms. I think the incidence was there, the prevalence was there, but it was underdiagnosed. Thank you.
Thank you, Abdulghani. That's very useful. There is somebody else raising their hand.
في سؤال من هنيدة، بس قبال ما هنيدة تسأل سؤاله، بس أنا أنبه الناس على السيرفي، البوست لكشر سيرفي. المشاركة لسه فيه ضعيفة، وقبال ما هنيدة تسأل سؤاله، بس كان في نقطة كان يتكلم فيها دكتور ياسين عن الهناية، الكوموربيديتيز بتاعت الهناية بتاعت الأوتيزم سبيكتروم ديس أوردر. وأنا أفتكر it draws the line between the boundaries between autism and comorbid conditions اللي هي مثلا زي OCD والكيتاتونيا. I'm just sharing a paper that I just published about a week ago. It's about autism and catatonia. Just share it for the audience. بعدين.
Oh, thank you. Can you put it in the chat?
Yes.
Link.
I shared it in.
Thank you very much. That's very congratulations.
Thanks. هنيدة تفضلي.
صراحة هو مش سؤال يعني، لكن هو يعني العمل اللي اشتغلنا هنا في مصر. فنحن هنا كان سبحان الله بنشتغل في الدي كير، فبجيب لنا الأطفال من عمر 2 ل4، فبنشتغل معاهم اللي هو كان العلاج التكاملي الحسي والتخاطب والمهارات الأساسية تطويرها، وحتى السيلف كير. فصراحة كان نتائج حلوة شديد. يعني أنا مما دخلت، مع إنه كان 3 شهور بس، لكن أنا مما دخلت البرنامج لحد ما تخرجت ما شاء الله، لحد ما انتهيت منه، في بعض منهم أو واحد يعني كان اتخرج الحمد لله والشكر لله، فشبه ما شاء الله يعني أنت بتحس إنه يعني كأنه نورمال. يعني البرنامج كان حلو شديد. تاني في برنامج بيدعمل للعمر 6، ده بيكون individual. يلا من عمر 7 فما فوق لعمر 9 بيقوم عندهم الكير جيفر، بيعلموهم كيف يتعاملوا معاهم والاستجابة تكون كيف. والبرنامج برضو كان برنامج جميل جدا. فصراحة يعني أنا يا ريت الحاجة دي لو انتقلت للسودان يعني.
شكرا شكرا هنيدة للمشاركة و very nice service you are doing in Cairo.
شكرا
السلام
لك
عليكم
أوس،
ورحمة الله.
شكرا لك.
السلام عليكم ورحمة الله. دكتور خلف الله R1
خلف الله،
ريجسترار.
معلش بس انا
ياسين.
ترفع يدها، بس استنى، شايف دكتور انا رافع يدها. تفضل.
السلام عليكم. Thank you very much sharing your child experience, Mr. Nazar. I hope he's doing well so far. أنا عندي سؤال بإنه هل في أعراض اتحسنت، يعني مثلا من الفلابينج أو كده، أو في symptom تاني emerge as he become adult، يعني لما كبر هل جات أي أعراض مثلا ظهرت؟ هل يعني الكلينيكال بيكتشر اتغيرت؟ أشياء ظهرت جديد؟ شكرا.
Yeah, thanks for that. Thanks for this question. All the signs, you know, when I said he was flabbing, no eye contact, he's not responding to his name, there is a communication challenges and social behavior, and all the signs which the doctor already talked about it, all has been disappeared, which is that is why we are lucky, because we work together. There is no sign left now. I'm telling you something. If you look at him and you compare between the current situation and the past, it is totally different. You're going to see a normal person, a normal boy, but the only sign which he still remain, he will sit with you, he will not communicate, he will not create any subject to talk about, he will not engage with you in any communication unless you ask him, or unless he hear his names. That's the kind of
I remember also, Nazar, I remember you told me that he used to be very aggressive, but now he is not aggressive. Yeah?
Yes, totally changed. He was challenging behavior, aggressiveness, and self-harm. All this now, it is
improved.
We are a peaceful boy right now. Peaceful.
هل في أعراض ظهرت؟ يعني هل في أعراض when he become adult emerge ظهرت الحين؟ هل في عرض يعني محدد؟
Yes, we have things where until there is a kind of digestive system issue still, even if it's become more difficult, because whenever we go back to the normal life where we can eat normally anything with his brothers, but between 3 days to 3 days his body is kind of fully toxin, unless he vomiting and he got migraine. So this is a continuous case. Also, he was not a normal. It is a digestive issue. He can't continue eat normal for 3-4 days unless he got a migraine, he got a stomach, and he has to vomit. And once he vomiting, immediately back to normal. It is from my information, from the many parents I met and I talked to them, most of the autistic people, they have a complicated digestive system. At this point, I raised this point with the doctor earlier or before, you remember. So that's the only things left now.
Thank you. ياسر.
خلف الله، تفضل.
طيب أنا عندي سؤال واحد ومعه إضافة. بالنسبة للسؤال كان ذكرنا في البداية يا بروف النيورو دايفيرجنت امبريلا اللي هو بيظهر بيقول إنه تحتها كل الديفلوبمنتال ديسوردر.
Yes.
فهل الكلام ده بيعني إنه يكون عندنا مثلا أوتيزم سبيكترم ديس أوردر معه ADHD، أوتيزم أو أوتيزم سبيكترم ديس أوردر ومعاه سيزوفرينيا مثلا، أو معاه ADHD أو معاه learning disability وكده، ولا لازم بيكون سنجل يعني diagnosis؟
Yeah, I think maybe you joined late in the talk. We did go through the comorbid conditions associated with autism, and we also mentioned that autism is not a single or a unique disorder. It is different disorders, and also it is a dimensional disorder, and it shared features with other disorders like OCD, a repetitive movement, schizophrenia, the psychotic symptoms. There is eating disorder, like Mr. Nazar has mentioned, like anxiety disorders, mood disorders, challenging behavior. All this can occur in the setting of autism. And the case I presented, it shows how many they have, like 9 diagnoses, including fibromyalgia, functional neurological disorder, in addition to all the other diagnoses I have mentioned. So it is multi-dimensional, and this is why the term neurodiversity now is used more than developmental disorder.
Okay.
Yasein?
That's answer my question. Thank you.
Thank you.
Thank you. Thank you for your question.
regarding الإضافة كان في there is a notion يعني بيقولوا إنه vaccinations of childhood يعني عندها relation with autism later on in life of the child يعني، فقاموا عملوا studies ولقوا إنه ما في relation يعني. حكاية
Yeah,
تقريبا studies دي اتعملت في أمريكا تقريبا.
You are correct. طبعا ظهر في الميديا انه الفاكسينيشن بالنسبه للاطفال can cause autism, but all the research done did not find evidence that vaccination is one of the causes of autism. There are risk factors which people mention. I don't know if I mentioned them or not. That one of the risk factor, vaccination is mentioned as a risk factor, but not as a cause. Other risk factor like the mother age, the obesity, psychotic symptoms, several. These are risk factor found in several different research projects. أنا دكتور ياسر شايف بروفيسور عثمان خلف الله
من قبل رفع يده. تفضل بروفيسور.
شكرا جزيلا ياسين. I am sorry I couldn't attend from the very beginning as I was involved in another meeting. Excuse my ignorance. I would just like to ask, is there any mode of inheritance in autism? Does it run in families?
Yeah, I think there is. I mentioned there is a significant degree of heritability, especially in the studies done in twins, not in the population. There is heritability is high in twin studies, but not in the general population. But that the prevalence now is being increased to 1%. Almost 1 in 100 people will have autism or ASD.
Is there any special genes يعني الناس did you يعني research did it show there is special genes in the inheritance?
Yes, they identified like more than 100 alleles which they link to development of autism. This is why now they are looking for biomarkers to help with the diagnosis and also with counseling for relatives.
Thank you very much.
شكرا بروف، شكرا لمداخلتك ووجودك معنا، ده شرف كبير لنا. ياسر.
عامر تفضل.
شكرا لك.
السلام عليكم ورحمة الله. عامر عبد الرحمن. I have questions. Recently, before an hour, or lastly, eventually that you said that there is no need for any medications for ESD patients. But when I have a patient of ESD coexisting with or comorbid with psychosis, definitely it's replaced by disorganized behavior, screaming, aggressive impulsivity, hostility. And as you said before as well, that is, complexity, and it's so strong, so hard to diagnose the ASD patients. So in this matter of situations, can I give a medications for this child? And exactly what you prefer? Is it for a psychosis, antipsychotic, typical or atypicals? And what can you advise me to deal with this kind of patients coexisting with schizophrenia or a disorganized behavior psychosis? Thank you, Doctor.
Thank you. This is a very important question. I did mention that the treatment, there is no, as Dr. Abdelghani also emphasized, that there is no specific treatment for autism, but comorbid condition to be treated the same as in other other patients with mental illness. If it is psychosis, if it is schizophrenia, if it is depression, if it is OCD, if it is eating disorder, using of medication, as I mentioned, we use the same medication as we use for other conditions. The only advice is that to start low, at a low dose, because may be very sensitive to medication, and go slow. Start low and go slow. That's the main advice. But you can use any type of medication, as you saw from the patient I presented. I started him with 5 milligrams of aripiprazole, and he did very well by the testimony of his mother. And then I added duloxetine, and I will see him in 2 months' time to see whether he managed to go from 30 to 60. So but this patient is 19 years old. You talked about children. Obviously, the dose will be much lower, and also considering the tolerance and side effects and any toxicity.
آخر سؤال حناخده اللي هو من يعني حبيبنا جدا وقريبي محمد أمين مكرم، لكن قبال بس سؤال مكرم مشاركته في سؤال متكرر في الشات هنا، الرول بتاع الأوميجا 3 supplements folinic acid. Any evidence for this?
There is no evidence that any of these homeopathic or herbal have any effect on the autism people. But obviously, if you go in the internet, there is a lot of marketing of these products. Sometimes maybe the more psychological effect to the parents rather than to the patient. And I think from the testimony by Mr. Nazar about his son, it's how the parents see that autism. He mentioned that his son now has a problem with eating. He will eat any food until he's full, and then he will vomit. So that's and he's using behavior therapy. He said he is getting organic food. That means organic food rather than the normal supermarket food, which is that's how they think it's helping their son. But I don't think there is any evidence from research to support omega-3 or other non-medication treatment.
مكرم اتفضل.
الله يبارك فيك ويسعدك قريب العزيز دكتور ياسر. صراحة قناتكم والبرنامج ده منعش بالنسبة لنا بصورة ما تتخيلوا أثرها. إن شاء الله ربنا يكتب أجركم وإن شاء الله في ميزان حسناتكم. سعيد جدا to attend this nice presentation of my great teacher دكتور ياسين القدال. ده من الناس كنا بنكون بنتبسط جدا لما نحضر activities.
انا برضو بكون مبسوط جدا لانك انت بالاضافه لماي كوليج and my previous trainee بعتبرك شيخي برضو.
الله يبارك فيك يا رب يسعدك يا خالد. فالدكتور ياسين القدال سينس ايرلي اون كان متخذ قراره انه يبقى سايكايترست، وكان في الجامعيه سينس هي واز ان ذا اندر في كليه الطب، وهي went forward صراحه، وهو كان excellent example for us all and a very nice role model for us in the specialty. لحد ما هي يعني chaired الارامكو هوبكنز ديبارتمنت اوف سايكايتري في الشرقيه، ولحد ما رجع الان لبرايتون in the UK. طيب انا مشاركتي حتكون مقتضبه وسريع جدا في نقطتين اساسيات. طبعا المجلس دكتور عبد الغني دي جريت جوب كان في انه تتفتح فيلوشيب في تشايلد سايكايتري في مجلس التخصصات الطبيه، وبدا العمل فيها، وكان الستيرنج كوميتي وير دوينج فيري ويل in it. وبعد ذاك شويه بقت في some challenges وتاخر انشاء البوست جرادويت فيلوشيب in child and adolescent psychiatry. لكن hopefully ان شاء الله اللجنه ترجع ويستمر الوضع ممتاز. طبعا كنت مشارك as a medical educator not a child psychiatrist. I was member in that committee. طيب الموضوع بتاع الاوتيزم في الميديا، طبعا ده من الاشياء اللي في الميديا منشوره بصوره عجيبه جدا. يعني واحده من القنوات الفضائيه كان مستضيفه واحد ينظر تنظير والدرين وديل عندهم مهارات عاليه جدا بولي تالنتد وممكن يكونوا يونيفرستي بروفيسورز، ورفع الاكسبكتيشنز للفاميليز، والامهات تسال يعني فريكوينتلي وانويد وذ ايشو. في نهايه الحلقه شكروه الباشمهندس فلان الفلاني الفلاني، فده الباشمهندس كان بيتكلم في الاوتيزم انفورشنتلي. ما نسمع يعني تنظيرات من غير ذوي الخبره في السبيشاليتي. طيب من الحاجات برضو المنشورة جدا في السوشيال ميديا أثر الجوالات على الأطفال في a certain type of autism spectrum disorder هو acquired autism. And by the way it's proven to have an effect with a clear cut يعني relation in etiology، لكن لسه النيورو biological bases are not clear. فوي did paper and I shared it بنفس طريقة الدكتور ياسر في الشات بوكس.
thank you very much.
فشوفوها دي منشوره في الباب ميد لبيبر عملناها ريسنتلي في عرعر عن السكرين تايم اكسبوجر والاكوايرد اوتيزم في عرعر عندنا نورثن سعودي ارابيا في التارجتد بوبيوليشن من التشيلدرن هنا. بصراحه في ريل ريليشن شيب، يعني ممكن تنزلوها وانه كان هافيد عشان ما اتكلم كثير في الموضوع. طيب الشيء الثاني برضو المهم جدا اللي بحب اذكره انه بالنسبه تريني سايكايترست، من الاشياء المهمه جدا وطوالي بتقابلنا كثير how to differentiate between autism and ADHD، لانهم بيظهروا كثير للناس frequently. وبايزوي حتى في التصنيف للهيئه السعوديه للتخصصات الصحيه لتصنيف استشاري سالوني كان في واحده من البانلز عن ال differences between autism and ADHD. It's very important to be يعني to acquainted with the differences. فنركز ببساطة في الاثنين فيهم classical triad of symptoms in both. في ال ADHD من اسمها inattentiveness في ال attention deficit والhyperactivity من الاسم اثنين plus impulsivity impulsive actions doing without thinking of consequences. فكده انتهينا من ال ADHD. يبقى ال ADHD عنده classical triad of symptoms inattentiveness hyperactivity and impulsivity. while ال autism spectrum disorder عنده 3 clusters of symptoms برضه triad of symptoms. أولا الcommunication problems، واثنين اللانجوج بيكون defective، and thirdly there are stereotype movements. فديل الثلاثة إذا خديناهم في بالنا زي الهيد بانجينج and others، الثلاثة ديل لو خديناهم في بالنا بيبقى عندنا السكيلتون that we could differentiate easily between ADHD and autism. Thank you. وما أطيل زيادة. شكرا على إتاحة الفرصة.
Thank you, Mukram, for a very useful and informative points and comments. As you heard in the presentation that we mentioned that the comorbid of ADHD and ASD is almost like between 30 to 51%. And also for people who think they are genius, that ASD, intellectual disability, is 50% of patients with autism have IQ below 70. Shukran, Yasir, and I don't know if you have anybody else there. ياسر.
شوف عثمان رافع يده ثاني، لكن افتكر يا جماعه بس عشان الوقت اسف بعد الساعه 12 يعني في بلاد معينه
لو سمحت سؤال واحد.
شايف دكتور فتح العليم.
السلام عليكم.
تفضل بروف.
الحقيقة بستفسر إذا كان if there is any relationship. لا فتح العليم محمد عثمان تريني.
تريني مش بروفيسور عبد الفتح العليم. خلاص رجيناك بروفيسور.
شكرا جزيلا يا بروف، بارك الله فيك. الله يسلمك.
قبلي
any relationship.
عاوزة ما اجاوب على سؤالك، عاوز انبه ياسر انه عندنا ضيف دكتور معتز بيدياتريشن من قبيل رافع يده مع بروفيسور عثمان خلف الله، فممكن تديه الفرصة بعد فتح العليم. شكرا. تفضل فتح العليم.
الحقيقة عندي سؤال بسيط. Is there is any relationship between intrauterine infections يعني during pregnancy and autism such as يعني toxoplasmosis، ولا إذا كانت الأم مثلا she was taking during her pregnancy for any reason sodium valproate، يعني these two could be considered as a risk factor from the researches or no?
Yeah, sodium valproate is considered as a risk factor, but infection is not being mentioned in research. But the mother age, the mother health, and the obesity, and also sodium valproate is mentioned as a risk factor.
دكتور معتز موجود معنا؟
Thank you.
معز هو.
Good evening, everybody. It is a great pleasure to meet with you. I have a quick question. Could someone who have autism in the past, which was undiagnosed or underdiagnosed due to difficulties in diagnosing this autism during childhood, could it be completely resolved condition or something which has consequences in his adulthood? Maybe I can rephrase the question. Someone who is having autism in his childhood, of course, in the past, it was difficult to diagnose it, particularly in Sudan. So does it have any consequences in his future or adulthood? Or does something could be resolved completely? Sorry, maybe...
شكرا معتز. I understand the question. I think as mentioned that somebody got their microphone on. Autistic symptoms start to appear when the person start to do more challenging task using certain areas of the brain. This is why autism symptoms start to appear. This is why they appear like in Nazar's son after the age of 3, when you are called to address more complex tasks or behavior or socialization or whatever. if somebody gone through to adulthood without any symptoms, even though they have been diagnosed, then they have improved. In fact, autism in adult people with normal IQ improve with age. So that could happen, but it depends on the degree of autism. It depends on whether it has an intellectual disability, comorbidity, or other comorbid conditions. ياسر؟
افتكر كده ما عرفتش، شايف بروف عثمان خلف الله مرفوع يد، ولا ده هي نفسها كانت من المحاضرة؟
ده نفسي يا معتز.
خلاص انا اسيب الميكروفون دكتور عبد الغني اذا شوف اي تعقيب نهائي قبل ما نقفل المحاضرة.
أوكي، شكرا ياسر. شكرا جزيلا دكتور ياسين. كما عهدناك دائما very interesting presentations, very informative lecture. وشكرا لضيوفك الكرام وبالذات الأستاذ نزار المدني، شاكرين له he shared his experience معنا. وشكرا لكل ضيوفك الأساتذة بروفيسور عثمان خلف الله ودكتور معتز وزملائنا الأساتذة ومتدربينا. بس في announcement, next week is going to be journal club supervised by دكتور عبد القادر حسين. فدائما نحن في journal club بيكون في critical appraisal two scientific papers بتتقدم. فلجنة النواب أو كل المتدربين الموجودين دلوقتي by Tuesday المفروض يكونوا اختاروا الترينيز. و I prefer إنه ما ناس قدمت قبل كده يا إخواننا. زول ما قدم قبل كده، في ناس قبل كده قدمت كيس برزنتيشن، في ناس قدمت جورنال كلابس، وفي ناس بتكرر. يدوا الفرصة للناس اللي ما قدمت و from different grades from R1 ل R4 يعني، بس يكونوا اثنين جداد. و by Tuesday you have to contact دكتور عبد القادر توروا البيبرز اللي عايزين تقدموها و take his advice please. فلو هنيدا فيه ومحمد ياسر أعضاء اللجنة please put this in your consideration. نشكركم
حاضر يا
شديد
بس إن شاء الله. حاضر.
شكرا. ما عندي حاجة إضافية يا دكتور ياسين ودكتور ياسر والجميع. شكرا لكم.
شكرا لضلعني. شكرا.